Is it possible to fix a facial trauma suffered in an accident?
If anybody who has undergone a road traffic accident or any facial injury or anything, we treat those patients. So if you ask me what are those injuries it may be, first those injuries can be any soft tissue injuries or any hard tissue injuries. Soft tissue injuries may be any injuries in the skin, on the face. See now, if you see the today's graph, most of the road traffic accident is according to 20 years to 30 years, means the youngsters. So they are very much vulnerable with the road traffic accident. So whenever any youngsters get met up with an accident, they are one of the main injury they suffer is the facial injury, like the face got abrasion happened, a deep cut has happened on the facial skin, or because of the severe major injury the upper eyelid or the eyebrow is completely missing, or his face is disfigured. So all these things can we treat, all maxillofacial surgeons. So coming like you may ask like what's a big thing about a maxillofacial surgeon to treat small facial injuries or not. See, it's very important. See, the youngsters are means they are very much influenced with the social media. So if anything, a small scar, small mark, or if any disfigured face is there, it makes a very big difference in their own social life or even their own personal life also. Ladies or youngsters who met up with an accident, and if you see like after the met up with accident you didn't took care very nicely the facial wound or any facial laceration, you are going to any tertiary clinics or any pharmacy and you have done some small dressings and all, and or you are going to somewhere government hospital or somewhere else and they are not taking care of your skin properly, or they are not using the proper materials which is required to suturing and for dressing, then all of them will end up with a very bad scar. So these all things gone with the scar. Now I will go for the bones. See, the facial bones are the main mosaic of the facial structure. If anything happen wrong with the facial bones, the facial disfigurement happens, and if you don't treat as soon as possible, those deformity will be there with you for their whole life, because at last 100% correction can't be done. We can bring the correction up to 90 to 95%, but 5% differences always will be there. So I'm just telling you, like if any like eyeball, like orbital bone which we tell, if it gets fractured, okay, both the eyes will be in the same level. So if there is any fracture, both the eye levels will be not in the same level, one will be go up or other one will go down, so the patients will see two persons, like not one, we call diplopia. So all those surgeries we do. Then second is the nasal bone. That's a very important bone. See, the nasal bone is the most prominent part on the face, so if anything injury happens, first the nasal bone gets fractured. So if the nasal bone is fractured and if you don't get treated, then the nasal deviation happens, the full facial structure or facial asymmetry gets dearranged. So you should, whenever nasal bone fractures, you should come immediately and you should get this nasal bones corrected. Or if you haven't done that at the time correction, maybe after some months you can come to us and then we can correct those nasal deformities. We call rhinoplasties, those surgeries. Then come to the jawbone. The jawbone is one of the most important bone while chewing or for regular purpose. So if any jawbone is fractured and if you don't get treated and if you do some local dentist work and all, so those deformities will be there for your whole life. You will not able to open your mouth, you will not able to chew properly, your face will be deviated on one side, your teeth arrangement completely will scattered. So if any jawbone fracture is also there, those things also we treat. So like this, lot of facial bones and facial corrections are still there to more to discuss. So stay tuned, I will keep on giving you more information about the facial injury. Thank you.